Now, for this session, we're going to talk about the humeral U-slab. This is one of those plasters that fills everybody with dread. It's a rather complicated plaster to put on, but the particular problem with it is that in a lot of the textbooks and the videos like this one, we've got healthy volunteers who are able to move their arm around quite happily without any problems. The reality of the situation, however, is very different, in that when you've got a patient with a fractured humerus, this is quite a painful procedure, and to move the arm around to be able to get the slab on properly is quite a painful procedure. And often in younger patients, you may need to actually bring the patient into resus and give some sedation, some strong analgesia to be able to do this. So do bear that in mind. There's two groups of people that present with diaphyseal fracture of the humerus. Usually it's elderly patients, but we do see it in younger patients as well. Classically, it's the young, fit man who's been arm wrestling and ends up with a mid-shaft fracture of the humerus. That is something that we get to see a lot. So do bear that in mind. And also, remember that it has to always start up from the top of the shoulder, so you do need good exposure. What we're going to do here is actually wrap up this, so we're not making much of a mess. Beforehand, but got an area exposed. Okay. Now, the measurements. So if you feel the acromioclavicular joint and the clavicle itself, you should ride at least about 5 or 6 centimeters above there, so about hand's breadth over the ACJ. And we go down to the elbow and then back up this way. So if we're measuring, we're measuring with the measuring tape now. So ACJ, hand breadth above it, and then we go down, across, down to the electron arm, and then back up. Okay, okay. Just to the axilla. Okay, so once we've got that measurement, so this is actually one of the few indications where it is reasonable to put the wet plaster rolled up into gauze, into wool, and then apply. Because trying to then wrap up the broken arm in wool is actually quite painful, and often patients find that intolerable. So, generous with your wool inside. There we go. So, there we go. Now, something to say about plaster, it always shrinks when you put it in water, so when you're making your measurements, always add a little bit extra to account for that shrinkage. Okay, so then try this on. Right, there we go. Side. There. So, down. Just down this way. So what we do is we lie the plaster, as we said before, right up into the head. Okay. Down. And then we lift the arm. So this is where we need assistance usually. Okay. Hold. Usually what will happen at this point, this can be quite uncomfortable for the patient because you're moving the fractured limb. Okay. Now, that's moving limb. There goes it. Put the arm in position. Plaster is on. Okay. So This is holding right onto the shoulder, and it's anchoring there. So with your assistant holding in on the position, we then fix this with some that. Just going to make sure this position is okay. Okay, covered. Over. So again, try not to do this too tight. Nice. Under. Down, so we've got our slab that's holding down. And we secure this. Yeah. That's fine. Now, this we can secure down. So this top bit, we then secure down with sticky tape. Hyperfix or Elastoplast with a long strip over. Clearly, if you've got a male with a bit of hair on their chest, that's going to be a little bit painful. So you may want to trim the hair and shave before you do that. But that's the position that it holds in. And of course, with any humeral injury, there's a few things you need to check after you've manipulated it, so distal sensory function. Specifically, you need to check that radial nerves intact, whether you can also flex the wrist. Okay.